Have you ever been concerned about the level of care you receive at a hospital over the weekend? New research suggests that you are more likely to die after surgery if you have been admitted to a hospital on a weekend.
It's often called the weekend effect. CBS News contributor Dr. Holly Phillips is here to explain. Holly, thanks for being with us. What did this study find?
Well, this study was particularly impactful. It came out in one of the British medical journals, but it showed that this is an international phenomenon. It had been well documented in the United States before, but now they looked at data in the UK, in the Netherlands, and in Australia, and they showed that this was an international issue. So what they found overall was that if you were admitted to the hospital for a planned surgery on either Saturday or Sunday, you had between an 8% and a 20% greater risk of dying during a 30-day period after than if you had your surgery during the weekend. Another important finding of the study was what they called the Friday effect, which seemed to be particularly dramatic in the Netherlands, where if you had surgery on Friday, your risk of dying was 33% higher than if you had the same surgery on Monday.
So what causes this? Is this the experience level varying from who's working during the week versus the weekend?
Yeah, that's one aspect. This study did not establish a cause, but other studies have suggested it has to do with resources and staffing during the weekend. For instance, not just doctors and nurses. For instance, there might not be as many radiologists available to interpret x-rays, or blood work may take longer to be processed on a weekend because of staffing. But probably the biggest issue has to do with what we call sign-out. When doctors and nurses and other healthcare staff change shifts, we have a process called sign-out where we tell each other what's going on with the patients on the floor. What concerns, what sort of labs need to be followed up, what type of care they need. And it seems that things are lost in translation when that happens. I liken it to an Olympic track race where when you analyze it, the race is lost not around the track. All the runners are pretty much running the same speed. The race is lost during the handoff of the baton. If anything goes wrong there, that's where you lose your seconds and you lose the race.
So what can patients do?
Well, ultimately, the biggest picture is that if you need surgery on the weekend, have it, right? Your burst appendix is more likely to cause you problems than the weekend effect. But on the other hand, don't be afraid to speak up. If you have any concerns or if you feel like any aspect of your care is being overlooked, talk to the doctors, talk to the nurses, or ask for house staff to come and see you.
So it seems like
people are sharing photos on social media of a new type of body art, designs created by exposing parts of the skin to the sun without protection. So, Dr. Holly, explain exactly what this is.
So this is a new sort of fashion trend. People are putting pieces of paper or essentially stencils on their body and then deliberately getting a sunburn to create a design effect on their skin. Now, I'm not one to comment on people's aesthetic choices. Whatever you want to do is cool with me. But I have to say, whatever happened to self-tanners, right? That you could get the same effect by just doing a spray-on tan. The issues are that if you have more than 5 sunburns during your youth, right, under the age of 18, it raises your risk of melanoma, which is the most deadly skin cancer, by 80%. So if you want to do your designs, just spray it on.
This is surprising in this day and age to go out and get that. It's so dangerous.
Sure. Yeah, I think it's one of these things where we talk a lot about sun safety, but particularly for young people, there's a sense of invincibility. Oh, we don't have to worry about it now. But the research shows just the opposite. We need to worry about it earlier and more.
For those of us who do worry about it, just a reminder, what level SPF should we all be using?
Sure. The ideal SPF is 30 or higher, but sun protection doesn't just come down to SPF. Most importantly, look at the label and make sure that your sunscreen covers both UVA and UVB rays. That's even more important than the SPF number.
All right, Dr. Holly Phillips, thanks so much.
Great to be here.